Hello, this is a general video overview of the risks that go along with a hysterectomy. Remember, I don't know your details and you need to find that out from your physician. Everyone's an individual, but there are some general overall risks that I can go over with you so you can be more prepared. The majority of hysterectomies that I perform today and increasingly throughout the United States are minimally invasive. So I'll focus on that, but we'll touch on others. So minimally invasive means laparoscopic or laparoscopic assisted or vaginal hysterectomy or robotic assisted hysterectomy with for example, a Da Vinci robot. That's the surgery I do most commonly. So in that surgery, you would have 3 8mm trocar sites, puncture sites. You might have 4, you might have more. Again, you need to speak to your physician for the details of your surgery. All surgeries have some risks, and one of those risks is bleeding. Oftentimes the reason to get a hysterectomy is because of excessive bleeding. And oftentimes the surgery itself has a lower risk, or we're solving that bleeding risk. But if you do bleed enough with or without surgery, you might need a blood transfusion. Transfusion itself has some risks, like risk of getting infections like HIV or hepatitis. Those risks have been 1 in a million or 1 in 2 million, though those exact numbers may change with time. The point is the risk is very small, but non-zero. There's also a risk of anesthesia. That's the medicine that we give you so you're sleeping, you're not experiencing the discomfort of the surgery. And depending on your overall health, that can be a small risk or a more significant one, and it depends on whether you have heart disease, lung problems, breathing problems, your weight, whether or not you're a smoker. That's a good point for me to bring up right away. If you are a smoker, staying away from cigarettes, well, is always a recommendation. I'm sure you've heard it, but it's of significant importance around the time of surgery, especially a few weeks before and a few weeks after. It can mean the difference between you having another one of the complications, infection, or blood clots, deep vein thrombosis, that's a blood clot in your legs, or one that goes to your lungs, of having a really good outcome or having some of the setbacks. So really work hard on staying completely away around that time from cigarette smoking. So let's get back to one of the other risks. Another risk is infection. Depending on the type of the surgery for the hysterectomy, generally you will get a preventative antibiotic to reduce your chance of an infection. If you do get an infection though, that can be a bladder infection, an infection in your incision, an infection in your abdomen, that's called the peritoneal cavity, and it can often, it doesn't happen too often, but if it does occur, it can delay your healing, or it can put you at significant risk. So it's important to take measures to reduce the chance of infection. There's also risk of injury to adjacent organs. That's basically when you put sharp instruments near the human body, there's a chance something will get cut or injured that wasn't meant to. It means doctors are human and errors occur. Things that can get injured are bowel, bladder, blood vessels, and other parts. You will have more tailored information, again, based upon you in particular. For example, let's say that you've had a C-section before. Well, when you have a C-section, the area that we go on the uterus is also the area where the bladder is. So we move the bladder down to go in to take the baby out. And when that heals back, your bladder can stick a little more there and you can get a scar. So when we do a hysterectomy, we have to peel your bladder off of your uterus, and sometimes it gets a hole in it. If it does, we repair it, but you'll need a catheter for usually 10 days so that it can heal up and not inflate with urine for the process. Still a low risk, but it is a little higher risk if you've had a C-section or other reasons. Again, discuss that with your physician. So overall, those are some of the important risks of the surgery. I haven't gone through the benefits. I haven't gone through why you're having the surgery, that's what you need to be talking to your physician. There are other risks that pertain to additional procedures like bladder tacks or suspensions or mesh, but that's not for this video. Just to give you a general overview so that when you speak with your physician, you get a more tailored response for you and you have a general idea. I hope you find this helpful, and we welcome your feedback. Thank you.